Hi Cheryl, I'm Victoria Coulthard.
And I'm Jamie Harvey.
We're from Section 2, Lab 2, and our article was Raw Milk Consumption Among Patients with Non-Outbreak Related Enteric Infections in Minnesota, USA, 2001 to 2010.
So throughout this video, I'm going to be the patient and Victoria is going to be my nurse.
Hello, Jamie.
Howdy.
What brings you here today?
Well, I'm doing this survey to see if raw milk consumption leads to other diseases, but I just have a couple questions I was wondering if you could help me out with.
Sure, ask me anything you want.
What's an enteric pathogen?
Well, Jamie, an enteric pathogen can be described as a gastrointestinal organism. These organisms are spread due to the contamination of food. It is animals that cause this organism to spread to the human carriers.
Okay. So what is pasteurization?
Well, Jamie, when you go to a grocery store, what kind of milk do you typically see?
Pasteurized?
Awesome. This means that the milk went through a very specific process. This process includes heating to a specific temperature for a specific period of time. Once the time is up, the product must be cooled immediately. This process is known as pasteurization, and it is what prolongs the spoilage of food.
So what's Campylobacter?
Campylobacter? Well, it is found in animals. It is bacterium that is transferred by animals from feces. Humans will get the infection from the animal feces. The bacterium can be transferred from person to person. When a person is in contact with the feces of the infected person, they will then retract Campylobacter. A Campylobacter bacterium targets the digestive system by infecting and attacking on the lining of the intestines.
So what are some signs and symptoms of that?
Any signs and symptoms of this bacterium will be noticeable between 1 to 7 days of the ingestion of the bacteria. The signs and symptoms would include the following: a fever, abdominal cramps, and diarrhea. If an individual has abdominal pain, that may be due to diarrhea. Usually, Campylobacter can be mistaken for appendicitis.
So what is Cryphosporidium?
Cryphosporidium may happen when small parasites called Cryphosporidium parasites. These parasites will enter the body and attack in the small intestine by burrowing in the walls of the intestine. Feces spread through Cryphosporidium. If another person comes in contact with an infected feces, they will now have Cryphosporidium.
So what are some signs and symptoms of that?
So Jamie, some signs and symptoms of Cryphosporidium will last typically for 2 weeks, constantly. However, they can last for up to a month, randomly. Some signs and symptoms that typically occur will be watery diarrhea, dehydration, lack of appetite, weight loss, abdominal pain, fever, nausea, and vomiting. However, everyone with Cryphosporidium may not receive any of these signs or symptoms.
So who's most affected by this disease?
Well, Jamie, it is typically children that are more affected than adults. And this is because when they live on their own dairy farm and they drink from their relative's dairy farm.
Okay. So what's the sample size of this study?
Well, Jamie, the sample size of the study was the state of Minnesota.
Is that a good thing or a bad thing?
This can be a good thing because the study was just based on the outbreak-related infections in Minnesota. However, everyone in Minnesota was surveyed and questioned. However, not everyone could respond. So this made the results skewed and inaccurate.
Should the results of this article be used without question?
I don't think that you should go based off of the results. Just because the results alone aren't exactly accurate. This is because there are individuals that did not respond to the survey. I think that the results could be taken for further consideration. When further consideration is done, I don't believe that these results should be taken on their own.
Okay. So what do the statistics say?
Well, the statistics say that 30 to 50% of the dairy farmers don't even know that these diseases are being carried within their raw milk tanks.
So what advice would you give me through all this?
Well, based on this article, I would advise my patients, like you, to avoid the consumption of raw milk. There are too many health risks associated with it, and it's not worth taking the risk of getting sick. I would also advise to keep young children away from the raw milk, as this disease was found in children the most. Okay. Is that everything?
Yeah, that's great. Thank you very much.
No problem. Bloopers!
Roll it! So, what's the sample size of this study?
Say it again, I flipped my hair.
Okay. Ew. So...
Ew!
Raw milk rocks!